Let's discuss hypoglycemia, a condition where the blood glucose levels drop dangerously low, leading to neurological impairment and potential loss of consciousness. Here are the key concepts that you should know about hypoglycemia, or low blood sugar. Low blood sugar is commonly caused by excess insulin, or when somebody takes too much insulin. This often happens when type 1 diabetics or type 2 diabetics take too much insulin through injection or are given too much insulin through an automatic external insulin pump. In addition, patients who are taking insulin can suffer from hypoglycemia if they take their normal dose of insulin but don't eat enough food. Hypoglycemia is defined as low blood sugar with a blood sugar reading of less than 70. A blood glucose reading of less than 60 milligrams per deciliter is considered a treatable blood sugar. Common signs and symptoms of hypoglycemia include confusion, dizziness, sweaty skin, also called diaphoretic, as well as cool and pale skin. Patients suffering from hypoglycemia may say things like they've been fasting or that they have an insulin pump attached to their body. A key diagnostic feature of hypoglycemia versus hyperglycemia, or high blood sugar, is the presence of altered mental status with cool, pale, and diaphoretic, or sweaty, skin signs. While altered mental status can be seen in both hypoglycemia, low blood sugar, and hyperglycemia, high blood sugar, the cool, pale, and diaphoretic skin signs are unique to hypoglycemia, while red or flushed, hot, dry skin signs are related to hyperglycemia. Here's a quick tip. Patients with a blood glucose reading of less than 50 are more likely to experience seizures, coma, and even death. Now let's talk about treatment. Patients with a blood glucose reading of less than 60 should receive glucose. For BLS providers, you may administer oral glucose, usually 15 grams or 1 oral glucose tube, and then need to reassess the patient in 15 minutes. If the patient's blood glucose reading is still low, you may repeat the oral glucose dose. Before administering oral glucose, you should make sure that the patient is able to swallow and is able to control their airway. If they are not, then you should withhold the oral glucose as well as any other treatments that you would give orally. For example, in some cases, you can give a patient food, such as a sandwich, or a sugary drink, such as orange juice, in place of the oral glucose if oral glucose is not available. ALS providers may be able to administer additional treatments. For example, ALS providers can often start an IV and give dextrose, which is preferred, and in some cases, if IV dextrose is not an option, they can give a medication such as glucagon. As a reminder, patients with hypoglycemia will often have altered mental status and cool, pale, and diaphoretic skin. They will present with a blood glucose reading of less than 60 if a blood glucose reading was taken. A common reason for the hypoglycemia is if the patient has been fasting or not eating, or if the patient is a type 1 diabetic and has an insulin pump that may be administering too much insulin. Want to watch the full video? Watch the full video and get so much more with your full access membership by going to howtonremt.com or scanning the on-screen QR code now.